Physical activity. It's good for your health and your well-being. And this is especially true for children, where it can increase their fitness, improve their self-esteem, their academic performance at school, and might even help reduce obesity. But less than half of children in England are physically active enough and do not meet the recommendations. To increase activity in children, there are a wide range of interventions available. One such intervention is called the Daily Mile. The Daily Mile is a school-based running program where children run or jog at their own pace for 15 minutes a day, at least 3 times a week. I'm Tishya Venkatraman, and my PhD is focused on evaluating the Daily Mile. I did this in 3 steps. Before jumping to study whether it works, so whether it increases children's activity, I focused on understanding which schools and children were doing it. Because some groups of children are less active than others, for example, girls and children from more deprived backgrounds, it is really important that the intervention reaches everyone and more so those who need it most. I then moved on to studying its impact. So are children registered to the Daily Mile actually more active than those not registered? And lastly, I evaluated fidelity to the Daily Mile. So are children who are registered actually doing a Daily Mile? I answered these questions using routinely collected data in England and by doing various kinds of statistical analyses. So here are some of the highlights of what I have found. The Daily Mile is being taken up by 1 in 5 primary schools across England. That means over 1 million children are registered to do it. It's also being taken up more by schools in urban areas and those with more disadvantaged children. When I looked at whether it was reaching children most in need, it was. You can see from the map here, the red areas of England represent areas that need to increase physical activity in children the most. The green areas are low need. They also do need to increase activity, but not as much. So here, 1 in 4 schools were registered to the Daily Mile in the red areas compared to 1 in 5 in the green areas. When studying the Daily Mile's potential impact, I found that children registered to the Daily Mile reported more activity in schools, but also outside schools. This is positive because it suggests that there might not be a compensation of activity as initially thought. Lastly, when I looked at fidelity to the Daily Mile, I found that unfortunately fidelity was low. Though this is a very common problem with physical activity interventions. So the take-home message of my PhD has been, grassroots movements work. They can reach those who need it most and they can have an impact. But more needs to be done to increase adherence and fidelity to these interventions, and they must be part of a wider systems-based approach. Thank you for listening.